Unemployed doctors in KwaZulu-Natal continue to stage a sit-in at the Health Department headquarters in Pietermaritzburg. They say they'll not yield until their demands to be absorbed in health facilities are achieved. In a State of the Nation address in February, President Cyril Ramaphosa promised that all unemployed doctors will be appointed by the 1st of April. Newzroom Afrika's Nobuhle Modise reports.
Unemployed doctors are on day 4 of a sit-in outside Natalia building, the KwaZulu-Natal Health Department headquarters. They speak in one voice, saying all they want is to serve South Africans. Following the State of the Nation address debate in February, Health Minister Dr. Nobuhle assured that money had been found to absorb unemployed doctors.
We have indeed found a solution to the current difficulty of employing the doctors who want to work in the public service. We are going to fund this post working with the minister. The details of how this is going to be funded will be stated by the minister next Wednesday when he will be delivering his budget speech.
Doctors say this is not the case as they're still jobless.
While there has been assurances from the ministers of health and of finance and the president regarding the hiring of doctors by the April 1st, the reality on the ground paints a different picture. The queues in our healthcare facilities continue to grow, with cancer and surgical patients facing long waiting lists for intervention to restore their mobility, their health care, and most importantly, their dignity. In light of this being the year of general elections, we are wondering if this was merely a political move to capitalize at the expense of the basic human right to health care.
Many doctors here say they have the option to move to private health care, but that they want to serve the underprivileged.
We are able to make a living in the private sector by doing locums, but that's not what we want to do. We want to serve the public health sector. That's not why we became doctors. It's not to sit in an air-conditioned GP practice seeing, 10 flu patients a day. We want to serve the children of our country. I want to be a pediatrician. I want to serve the babies of our country who are dying every day from malnutrition.
The general public is bearing the brunt of the situation.
My nurses are not fully trained. Or doctor, but they're fully trained. But because the system abasebenza ngaphansi why careless abasebenzi. Go kuma private hospitals, even ngisho unesi uyazi unesi osebenza kwi private hospital ukuthi isiguli isona esu number 1. Lana isiguli isona esu number last. Then the people will carry on dying.
Ngoba yini omunye umuntu ugcine seshonile enganakwanga. Ngoba yini ube khona odokotela ngabe usheshe abonakala itholakala nenkinga anayo. Ugovernment ifele mawusize ngempela ubaqasha odokotela siyabadinga. Abonje bahlala kakhulu abantu manje baningi abantu abangakanakwa ngaphakathi abadinga ukuthi ngabe sebebone odokotela abekho.
These unemployed doctors say they will continue with their sit-in and even escalate their demonstration should they not receive appointment letters. The Provincial Health Department says it has received funding from the Medium-Term Expenditure Framework, but that money is not meant for recruitment but for the wage agreement with medics already in the system. Health MEC Nobuhle says the doctor's plight is being attended to at the highest level of government. For Newzroom Afrika on Channel 405, I'm Nobuhle Modise in Pietermaritzburg.